Good evening, Doc. Good evening po sa lahat. Now we continue with tongue diagnosis made easy. Ang topic natin ngayon is cracked tongues. So, cracks are often but not exclusively a manifestation of yin deficiency. Yung body fluid nourishes and moisten the tongue in the same way that rain moisten the soil. So halos parehas po yung pag nag-ulan, mas namomoisten ang soil, ganun din po yung sa tongue natin. If there is too little rain, the surface of the earth cracks, and if there is too little body fluid, the tongue surface cracks. So may similarity po siya. Kung natutuyo, magkakaroon po ng cracks yung tongue. The shape and distribution of the cracks will depend on the type of yin deficiency involved. The depth and size of the crack will say something about how serious the situation is and how long it has existed. Katulad ng merong deep, long, and multiple cracks signify a more deep-seated imbalance than a single short, shallow cracks. So, doon natin ma-differentiate kung matagal na or mas malala dahil mas deeper siya, mas mahaba, or mas marami yung cracks kumpara doon sa opposite. A very swollen tongue may look as if it is cracked. So, pwede rin makakita tayo ng mga cracks sa pag ito ay swollen. But this is because the tongue is wrinkled and creased. The patient can be asked to pull the sides of the tongue outwards. If the crack disappears, the tongue is just swollen and not cracked. So, dapat i-verify po natin yun. Baka hindi naman pala yun is caused by having a crack in the tongue. By pulling on the sides of the tongue, you can also get an idea of the depth and thus the severity of the cracks. So, dalawa po yung use ng pag-verify ng pag-pull ng tongue to the sides, whether it is a true crack, and kung gano'n naman may talagang crack siya, so mabe-verify natin yung depth and severity ng cracks. Okay? Generally, the cracks on the surface of the tongue indicate yin deficiency or the tendency to eat. However, although this is the most common cause, there are others, such as dampness or deficiency of the original qi. So, other than the yin deficiency, pwede rin po magkaroon ng crack sa dampness or deficiency of the original qi. The horizontal cracks indicate yin deficiency, usually of the stomach and or sa kidney. And they are more commonly seen in the elderly. So, pwede tayo mag-expect pag ang patient natin matanda na, so we could observe mga sa stomach or kidney areas na meron siyang cracks, which is indication ng yin deficiency. So ito po yung picture ng horizontal cracks na pwede natin ma-observe sa ating patient. Irregular cracks usually indicate stomach yin deficiency or tendency to eat. So, observe po natin mabuti itong picture. Ito po yung example ng irregular cracks. A central short crack in the middle of the tongue is very common and indicates stomach yin deficiency or the tendency to eat. So, ito po yung picture ng stomach crack. Meron siyang crack dito sa middle. So, yan po yung stomach yin deficiency. Next, a central long crack in the midline of the tongue is also common. Its clinical significance depends on its depth and on the color of the tongue body, especially the tip. So, kailangan natin i-observe ang length ng crack and yung coloration. So, tingnan natin yung mga pictures na illustrated here. Okay. If the heart crack is shallow and the body color is normal, this simply indicates a constitutional tendency two heart patterns and does not have a specific clinical significance. However, if a person has such a crack, any emotional stress from which he or she might suffer will have a deeper repercussion than for someone without a heart crack. According to Dr. J.H.F. Shen, a shallow heart crack with a normal body color may also indicate a heart disease in the parents or even grandparents. So, pag nakakita tayo sa patient ng shallow heart crack, we could also ask sa history about the heart diseases ng parents or even grandparents. Okay? If the heart crack is deep, it indicates that the person may suffer from a heart pattern due to emotional stress. All the more so if the tip is also red. So, pwede po related sa emotional stress, lalo-lalo na kung may red coloration. The following are different situations of emotional stress in order of increasing severity as manifested on the tongue. So, una, we have a shallow heart crack, yung meron siyang normal body color. Next, no heart crack, pero red yung tip. Next naman is deep heart crack with normal body color. Next, meron siyang shallow heart crack and red tip. And next is deep heart crack and red tip. So ito po yung increasing severity. Next is deep heart crack with red tip with red points. Next is deep heart crack, red tongue with redder tip and red points. And next is deep heart crack, may red tongue with redder and swollen tip and red points. So, kung mapapansin nyo, ito yung additional description is may swelling dun sa tip ng tongue. A short transverse crack on the sides are a clear sign of spleen yin deficiency. This is not common and it is not a condition often described among the spleen patterns. Such cracks are easiest way to identify such a pattern. So ito po yung example ng mga meron siyang transverse crack, transverse spleen cracks. Tapos, itong isa is stomach crack. Okay? Short transverse crack behind the tip in the lung area usually indicate a past lung pathology, such as pneumonia, whooping cough, or repeated lung infection during childhood. So, i-observe natin yung mga short transverse crack behind the tips, behind the ng dulo ng tongue, which is the lung area. So this indicates yung history ng lung pathology ng patient. As such crack reflect fast pathology, they do not have a major clinical significance. Okay, so through asking sa history ng patient, mabe-verify po natin yun. An extremely deep midline crack with other small cracks branching out from it, usually seen in a red tongue without a coating, indicates a severe kidney yin deficiency with empty heat in the kidneys and heart. So, meron siyang extremely deep midline crack. Okay? So, ito po yung illustration ng lung cracks. Meron siyang diagonal, two diagonal sa lung area. Ito namang isa is a deep midline crack with small cracks. Okay? A short crack in the middle of the tongue indicates a deficiency condition in the stomach or spleen. If the crack and the area around it is red and lacks coating, this is a sign of stomach yin deficiency. If the area is normal or pale colored and has a coating, it will not be a yin deficiency, but spleen and stomach qi deficiency. So having a normal or pale color, tapos meron siyang coating, ano siya, spleen and stomach qi deficiency. If If the crack is deeper or wider with a sticky yellowish coating, it may look as if the crack is fury. It is a sign of stomach fire or phlegm heat in the stomach. So yun naman, sticky yellowish coating, stomach fire or phlegm heat in the stomach. If there are more irregular or transverse crack in the central area of the tongue, it will be a manifestation of stomach deficiency. If the cracks are more extensive and cover the entire tongue, this indicates stomach and kidney deficiency. Likewise, a longitudinal crack along the middle of the tongue with several transverse cracks extending out from it reflects a stomach and kidney deficiency. Okay? A crack that runs all the way down the center of the tongue and out to the tip shows that there is a constitutional weakness and the person can have a tendency to develop heart imbalances. So, meron siyang crack na hanggang dun sa dulo, sa front ng tongue. Two diagonal cracks on the front third of the tongue behind the tip is a sign of lung deficiency. So, yun po yung illustration kanina. May dalawa siyang diagonal cracks dun sa lung area. The cracks may be the remnants of an old condition such as a severe respiratory disease in early childhood that damaged the lung at the time. Sa short transverse crack on the sides of the tongue are signs of spleen qi and yin deficiency. Okay? So dito naman sa indication may excess heat. So ang tongue body is deep red and yung tongue coating is a dry coating. Sa deficiency syndrome naman, sa yin deficiency, ang tongue body niya is red body and yung tongue coating is no coating. Sa blood deficiency, ang tongue body is pale or slight red. Ang tongue coating is varied. While sa spleen qi deficiency with dampness, ang tongue body is pale, flabby with teeth marks. Ang tongue coating is varied. Sa pathogenesis, sa excess and deficiency, meron siyang excess heat impairs body fluid or a deficiency of essence, blood, yin, or body fluids. All lead to insufficient nutrition of the tongue body surface, which causes the cracks. Sa pathogenesis naman ng spleen qi deficiency with dampness, damp accumulation in the tongue body obstructs the fluid and blood from nourishing the tongue surface. Sa remarks, cracks on the tongue will occur in 0.5% of healthy people. So, pwede po natin ma-observe yung mga tongue cracks sa healthy people. In this case, there will be no complaints. The cracks are not deep, so hindi naman malalim. And they persist on the tongue unchanged. So, yung mga cracks na yun na stay doon sa tongue ng patient. In general, there are no cracks in a normal tongue. So, normally, dapat wala po tayong ma-observe na tongue cracks. The softness and suppleness of the tongue body shows that it is moistened by the fluids and nourished through the blood and yin. Heat and dryness account for the appearance of cracks in the tongue body. The small horizontal cracks are a sign of yin deficiency, especially when they appear on a red or slightly red tongue. As a rule, injury to the substance does not occur unless the pathology has been present for a while. This is one reason why cracks are rarely seen in the tongues of children. In adults, they appear rather suddenly, for example, during a severe disease, after chemotherapy, or when yin-inducing habits like cigarette smoking or frequent consumption of spicy foods are indulged over a long period of time. Okay? cracks in a pale tongue body can originate from a deficiency of blood. So, pwede rin magkaroon ng cracks, yung pale tongue body dahil sa deficiency of blood. If they are only superficial, this is an indication of stomach and spleen qi deficiency with blood deficiency. In the case of deep cracks, so malalalim na cracks, besides deficiency of blood, there may also be injury to the fluids. So meron siyang deficiency na blood, meron din siyang injury sa fluids. In a red tongue, cracks are unmistakably sign of the exhaustion of fluids or the onset of stomach and kidney deficiency caused by injury from excessive heat in the nutritive and blood levels. A red shiny tongue with cracks indicates severe yin and fluid damage. So, meron siyang severe yin and fluid damage, which makaka-observe tayo na may cracks na siya, meron din siyang red shiny tongue. Okay? A single small crack on the tongue body is less significant than cracks that are distributed over the entire body of the tongue. So the more cracks na makikita, mas severe po yung condition. In modern China, cracks are differentiated according to the following 3 degrees of severity. Sa first degree, meron siyang flat and short that is no longer than 0.55 mm and no more than 3 cracks. So, konti lang po yung cracks. Sa second degree, identical to the first degree except there are 4 or more cracks. So, mas dumami po yung cracks sa second degree. While sa third degree naman, the cracks have a depth of at least 1 mm and are longer than 1.5 centimeters squared. So, mas malalim and mas mahaba po yung cracks. Third degree po ang condition, okay? So here we have a case of a patient, female, 41 years old. Ang tongue po niya is pale red with slight spleen qi deficiency. Next, meron siyang pale sides which indicate that there is a liver blood deficiency. And kung observe po natin mabuti, meron siyang curled up edges which indicates that there is a liver qi constraint. Meron din siya mga horizontal cracks in the center which indicates that there is lack of fluids, stomach yin deficiency, onset of kidney yin deficiency. Sa likod ng tongue, there is a depression at the root which indicates that there is an onset of essence deficiency. So ang patient, meron siyang symptoms of headache, pain in the shoulder girdle, inner tension, exhaustion, poor memory, depression, and meron siyang toothache. Sa Western diagnosis, onset of periodontitis. Sa background to disease, pregnancy at a late age, breastfeeding for a long time, and meron siyang lack of sleep. So we have here sa cases 3, when Mrs. D gave birth to her 2 children, she was 38 and 41 years old. The first pregnancy, the extended period of breastfeeding and the lack of sleep led to severe exhaustion. She had to rest frequently in the course of the day in order to fulfill her role as a wife and mother. Her extreme fatigue made her very irritable. As her physical and mental stress increased, she experienced tension around the muscles of her neck and shoulders, which often resulted in headaches. During her 2 pregnancies, she suffered frequently from toothache and bleeding gums. So, may toothache, may bleeding gums, which was diagnosed as the onset of periodontitis. Her memory became much worse during this time. While the tongue body color was normal, the center was cracked. Her pulse was deficient, thin, and a little floating. Sa analysis, the essence in a pregnant woman nourishes the embryo and fetus. If the mother is young and strong, her essence will be of good quality, and the pregnancy will generally be without problems. Essence in women tends to decline after their 35th year. Thus, pregnant women over this age have less essence to draw upon. So, kailangan po mas mabuti ang maging pregnant before or hanggang 35th year. Often, mature women find that the recovery period after pregnancy is more difficult and prolonged as it was in this case. The depression at the root of the tongue and the slightly thin tongue body were the first indication of the loss of substance, which may have been accelerated by breastfeeding for 12 months. A part of the mother's blood is transformed into milk. Therefore, long periods of breastfeeding can injure the blood. If the blood becomes deficient, the kidney yin will also be affected. So, deficient blood, apektan po yung kidney yin, which can lead to insufficient support of the essence. The deep, small, horizontal cracks visible from the root to the tip of the tongue are another indication of kidney yin deficiency. So, ma-observe po natin yun sa tongue. Because the blood is insufficient, the liver cannot store enough of it, and this is reflected in the pale edges of the tongue. So, ma-observe po natin yung sa sides, yung mga edges. Ito naman yung sa liver insufficiency. Here, the edges are also curled up and an indication of liver chi constraint. So, observe natin, may nagka-curled up, pataas po yung sides. So, yan po yung liver chi constraint. Also, when the liver blood is deficient, it is unable to rise and nourish the head and the muscles of the neck and shoulders. Hence, meron siyang headache. Okay? Sa toothache is a common phenomenon during pregnancy. One explanation is that deficiency of kidney yin gives rise to heat from deficiency that transforms into fire and ascend to the teeth. So, meron siyang kidney yin, nagkaroon ng fire, and umangat hanggang dun sa teeth, resulting in a severe toothache. Another explanation for toothache and bleeding gums during pregnancy is the appearance of stomach fire. So, bleeding gums, stomach fire naman yung condition. Because of the existing deficiency of essence and yin, the yin of the stomach is not nourished, which may lead to stomach heat. So, deficiency ng yin, nagkaroon ng stomach heat. Heat injures the channels that supply the teeth, resulting in bleeding gums and toothache. Okay? So, poor memory and deep exhaustion, again, suggests a deficiency of essence. The deep exhaustion may also be exacerbated by underlying slight spleen chi deficiency. Okay? The deficient thin pulse reflect the general deficiency of chi and blood. So, check natin sa pulse, mahina din yung pulso. Its floating quality underscores the blood and yin deficiency. Okay? So, dito po, yung observation ng ating cracks, ang significance niya is dito sa summary. A short crack in the center, the area is pale and with coating. So, ito po is indicate that there is a stomach or spleen chi deficiency. Pag merong short crack in the center naman, the area is red and lacks coating. So, ito po nag-indicate ng stomach yin deficiency. The crack in the middle is deeper or wider with a sticky yellowish coating. So, this indicates that there is a stomach fire or phlegm heat in the stomach. Pag merong irregular or transverse crack in the central part of the tongue, ito naman nag-indicate ng stomach yin deficiency or stomach and kidney yin deficiency. Pag merong long crack along the central area with several transverse cracks spreading outward, so ito nag-indicate ng stomach and kidney yin deficiency. crack all the way down the middle of the tongue and out to the tip, ibig sabihin, there is a constitutional weakness with a tendency to heart imbalances. Okay? So sa middle ng tongue po yan hanggang dun sa dulo. Two diagonal cracks behind the tongue tip. This indicates that there is a lung yin deficiency. Short transverse crack on the sides of the tongue. Maikli lang na transverse crack. This indicates that there is a spleen qi and yin deficiency. Okay? Thank you po for your attention.